How do we have a baby that has sickle cell disease? So this happens when we have both parents being carriers. So in our bodies, the organs and the systems are coded for when we are still in our mother's womb. And these codes are carried on what we call the DNA. So for every organ or for every system, there are two codes, a code from the mother and a code from the father. These two codes will determine our height, whether you're tall or short, whether you're big or small. Determines the color of your eyes for those places where there are colors of eyes that people have which are different, to determine how organs are formed. So for sickle cell disease, it is the same. If you have genes from the mother and from the father that have sickle cell coding, then this child will have sickle cell. However, if one parent is not a carrier, then that parent will not have the genetic coding for sickle cell disease. In that event, the parent that has sickle cell carrier is the one that is going to give a sickle cell gene to the child, and the parent that is not a carrier will give a normal gene to the child, and this child will end up being a sickle cell carrier because of having at least one parent who does not have sickle cell traits. So that is, in a nutshell, how sickle cell disease is spread to the child from the parents.
The risk of transmission of sickle cell from both parents is 25% if both parents actually carry the gene. So sickle cell gene or sickle cell is denominated as a normal person has AA, which is what we call, that's what we denominate it in medical terms. A child with sickle cell carries SS, and a carrier carries AS. So if you have a parent who's AS and another parent, a father who's AS and a mother who's AS, if both of them are married and have children, then the risk of having an SS who happens to be a sickle cell child is high. So transmission of sickle cell being an inherited disorder is from both parents. So most people believe that you need one parent, because when we try to counsel parents, they ask that is it just the father or the mother? You need both parents to be able to pass on sickle cell gene to their children. And this gets me to a point where marital counseling comes in. Please find out your partner's status before you actually marry them, because this is very important. When we say 25% passing on to your child, we don't mean literally 25%, that if you have 4 children, then only one will have sickle cell. We mean that 25% is a chance, like the way you roll a dice. If you roll a dice, you can always land on 3. If you roll it, you can land on 6. So it means you have a chance of having only sickle cell babies, or you have a chance of having no more children, or you have a chance of having only carriers. So please check your partner or someone you plan to get married to so that you know their status and make an informed decision. Sickle cell presentation starts at 9 months, because that's when we expect the child's hemoglobin to be transitioning to adult hemoglobin. But it can come as early as 3 to 6 months, depending on the severity of the disease. How would you know that your child could possibly have sickle cell? First of all, of course, the family history. If you tested with your partner and you're both AS, then the risk of your child having sickle cell is high. But also if you know that in your family you have a risk of sickle cell. The signs and symptoms that the children could present with at this age will be yellow eyes. Sometimes you notice that your child's eyes color has changed and it's yellow. Some babies will present with swelling of the limbs and hands and legs, of your fingers and hands. And some children cry inconsolably because they are in pain and we do not know. Other children will present with low blood, which means that when you come in with a child who has a fever or they are sick and we check, we could notice that their blood is lower than it's supposed to be, and that raises our suspicion. And then we'll go further to do other tests to assess and see if this is actually sickle cell or not. Sickle cell is confirmed with multiple tests, but the common known one is HB electrophoresis. So we take off the blood and we go and be able to ascertain if your child has an S, if they have a fetal hemoglobin, if they have an A, and then we'll be able to deliver to you the results and tell you your child could be a carrier, your child could be normal, or your child has sickle cell.
Many times when you're a carrier or you have sickle cell trait, you may not have symptoms, and when you go ahead to have children, you may be surprised that your children are sicklers. And we've seen this multiple times where people are surprised that their children are actually sicklers and they had no idea whatsoever. Now, here at Nakasero Hospital, we run sickle cell testing all week round. We see patients through the hematology clinics as well as the pediatric clinics.
As we celebrate this year's World Sickle Cell Day, we'd like to invite couples that are intending to get married, that are intending to have a child, to come in for our preconception care clinics. Let us screen you for sickle cell disease. Let us screen and see if any of you is a carrier or not. Because if you're both carriers, then the risk is there that you'll have a child that has sickle cell disease. So come in, get checked, so that we can see that we have a sickle cell free child.